I think probably to like future medical students as they're coming to the hospice, there are plenty of learning opportunities that just present themselves in very small periods of time.
That experience of having to sort of touch a dead body and sort of perform those necessary tasks was really good, and it made me a lot less sort of daunted for my future as an F1, where I'm going to have to do that a lot. So sort of this certifying death thing, that has made me a lot less nervous about that.
We have up to 100 students, mainly Year 4 students from the Plymouth Medical School. We have approximately 3 a week for approximately 30 weeks a year, seeing different aspects of palliative care across the service. So they spend time at the hospice, spend time with our community team, and spend time at the hospital in Derriford, seeing the patients on the ward there.
I think for many medical students who've never been in a hospice before, it's definitely like a very daunting experience. You don't really know kind of what the patient's going to be like. As a medical student, you have to figure out what the doctors are like as well. And then added on top of that, you've got to consider potentially what the relatives and what people's loved ones are going to be like as well, and kind of what the interactions are going to be around that.
I think also I did imagine it to be patients in their last days of life. So I was quite surprised when I came here, and it was patients who were palliative, but they might even have like kind of prognosis of about a year or so. And they're here more for symptom management, and then we're discharged home at the end of it.
There's a lot of homely touches, like really a few things that just make people feel very comfortable just in the small things that they are. You know, having quilts that are patterned, having paintings and pictures up around everywhere. There are sofas and kitchens and lounges. Like all of those really little things, I think really help the atmosphere and help people to feel much more comfortable in what is a clinical setting, a place where people do come because they need medical support and they need input from doctors and nurses. And I think those little touches really help families as well adjust to that environment and just focus on that relationship that they would want to, really.
I mean, it gives you the opportunity to speak to patients who are obviously in quite difficult situations and have difficult conversations with them in quite a secure environment. A lot of them have been here for sort of a little while, they've seen medical students before, they know the sort of things you're going to ask and they're happy to talk to you, so that's quite nice as well. Sort of learning those sort of communication skills with people. I know we had a lot of conversations about what to say, not what to say, kind of between me and my placement partners. But at the end of the day, most people just kind of want to be treated as if they're not dying, just like a normal person, so that's quite important.
In palliative care, we focus on looking at individuals holistically, looking at the bigger picture. So we don't focus specifically on specific disease or specific organ. We focus on the patient, on the family, their social circumstances, and how all that affects people. And actually, I think the best doctors, whether it's they're surgeons, whether they're GPs, whether they're whatever specialty, are those that can focus on patients holistically, as a whole.
So, you know, if a doctor is looking through a drugs chart, making sure you know all of the drugs, because in a hospice, in palliative care, there are so many different names of drugs or different dosings of drugs or different drug regimens that you might not previously have come across, and the considerations for the patient can differ as well, just because of the nature of terminal illness.
All junior doctors will be involved with dealing with people who've died. That often is one of the most stressful aspects of being a junior doctor. We know from feedback that can be very stressful, very isolating for junior doctors, and actually by talking about it, by exposing people as a student, that will give people more confidence as a junior doctor as well.
I think I was asked so many times, are you okay, is there anything you want to discuss, like are you comfortable? And I think just to kind of speak up if you're not, and take that support that's there, because it's quite distressing, especially I think for some medical students who haven't seen patients who are dying before or seen a dead body before, and to take that support that's there, because it is genuine and it's okay to say I need a bit of help.
Ultimately, a patient is going to take their whole kind of life experience and put it in your hands, and I think the only thing that you can do in return is to understand that they have that whole life experience and you have to consider it all as well.